When the patient comes into the exam room wearing the DynaWell harness, it is important to ensure that the harness fits properly. The DynaWell harness comes in 6 different sizes: extra small, small, medium, large, extra large, and double extra large. It is not measured by the weight of the patient, but rather for the size. The vest has to have an opening of approximately 2 to 4 inches prior to compression. You don't want it to overlap, nor do you want it to be excessively wide. The other measurement is determined by looking at the patient's side. The strap should run along the midline of the leg or along the femur trochanter. If the vest is too small, the strap will end up in front of the leg, and when compressing, the patient will be pulled forward. If the vest is too big, the strap will end up in back of the leg, and the patient will be pulled backwards during compression. This is why it's important for the strap to be aligned with the femur trochanter when the patient is in a vertical position. Before starting the procedure, always make sure that the full length of the white line on the strap is visible. If it is not, release it using the adjustment knob. Make sure the white circle is visible. If the strap has become slack, adjust when using the side buckles. Make sure the patient is placed on the MRI table with the feet placed firmly on the scale or foot plate before anything is attached. Connect the lower strap to the harness. Make sure it's not twisted. When twisted, it normally will not fit into the latch. Connect both sides. Pull on the loose ends of the strap and firmly tighten. If the procedure requires 2 screens, one with compression and one without compression, always do the one without compression first. The reason for this is that the decompression takes a longer time than the compression does. Without the compression, leave the harness loose. Perform a conventional scan. After that is complete, simply place the patient under compression. Begin the procedure by going up to the patient, take the 2 chest strap buckles in hand, ask the patient to take a deep breath, exhale. While they are in the exhale mode, tighten the straps. Always tighten the upper straps first. When they are firmly snug, you can barely get 1 or 2 fingers in between the patient's chest and the buckle. Be sure to check out the front vest flaps are not overlapping. Same procedure again. Exhale, tighten the strap. The important thing about having the straps properly tightened is that if it is loose, a lot of the pressure will be applied from the shoulders, which can be very uncomfortable for the patient. We want the pressure to be across the rib cage, and the compression will be isolated in the lumbar region. 80% of the tension of the vest will be across the ribs and 20% around the shoulders. The simple explanation is that it is like wearing a backpack. You have your weight on your back, but the major pressure is focused as part of the compression around your chest and rib cage. Once the vest is tightened, you will move down to the bottom of the foot plate and scale. Make sure it is set at 0. We're going to use between 30 to 50% of the patient's body weight, divided equally on both legs. To simplify, 15 to 25% on each of the scales. Never use more than 50%. In this case, we have a 150-pound patient, so we are going to use 60 pounds from the area from where the lumbar spine is divided equally. That will be 30 pounds compression on each leg. By simply turning the 2 knobs simultaneously on both sides of the device, the same direction clockwise, you're applying the pressure the scale is indicating. The pressure is being applied to the patient. Simply turn the knobs until you reach the desired weight. Wait for 5 minutes before beginning an MRI or CT scan. When it comes to releasing the patient from the pressure, always start by bending the patient's knees all the way up. In cases where the patient is unable to bend their knees, decrease the compression by releasing the compression adjustment knobs simultaneously. Let the patient know that if they are in pain, they can always release by bending their knees slowly. Do not release the straps without first removing the tension. Unbuckle the straps from both sides, assist the patient to descend the table safely, and then remove the vest by first unclipping the chest straps. To release the strap from the wheelhouse, on the right side, pull the lever and release the strap. On the left side, push the lever and release the strap. If the strap has been pulled too far into the wheelhouse, simply pull out the lever and lift out the knob to release the strap. Once you have unwound the excess strap, simply put the knob back into its original position. Make sure you pull out the lever and the knob will come down into position. If you then turn the knob to tighten the strap, you will hear a firm click and you will then be assured it is in position to properly adjust the load on the patient.
Thank you, and please contact DynaWell Diagnostics 702-914-0022.